The Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, has called on the Ministry of Health to include healthcare workers in the COVID-19 vaccination process. Speaking during a national delegates meeting, KMPDU Acting Secretary General Dr. Chibanzi Mwachonda said that involving healthcare workers will ease the process. Chibanzi with more.
The Ministry of Health prepares to facilitate a rollout of the vaccine against COVID-19 in the country. Healthcare workers have decried the lack of inclusion of health unions in the vaccination program. The first phase of the vaccine is expected to begin from mid-February to June this year, with the first phase targeting 1.25 million Kenyans.
We would like to urge the Ministry of Health on that specific matter of vaccines, that without involvement of healthcare workers, doctors, nurses, clinical officers, all other healthcare workers, getting Kenyans to accept the vaccine and even healthcare workers is going to be a tough challenge.
Mwachonda has also called on the Ministry of Health to act on the return to work formula, which was signed on the 24th of December last year. The formula was meant to enable counties to procure comprehensive group life, last expense, enhanced work injury benefits, and group personal accident insurance cover for medics. But so far, not much has been implemented.
Moving forward is to urge county governments that signed a return to work formula with us, which provided for insurance for all our healthcare workers by the end of this month of February. That should be implemented. The contract extension of the doctors working in the COVID-19 isolation and treatment centers that have come to an end should be renewed. The country cannot afford to let its doctors go back home and stay without work, and yet we still have a COVID situation in the country.
In the same breath, the union has castigated Health CS Mutahi Kagwe for allegedly stifling health unions by stopping their monthly remittances. In his statement, Chibanzi Mwachonda wants their remittances reinstated, failure to which they will announce their next course of action.
If you stifle unions, you're basically stifling the voice of workers who run this country, be it in the health sector, be it the teachers, as we have seen that undergo that. And now it has come to the health sector. And it's a worrying trend because it looks like that is now becoming government policy. So as unions in this country, we will not lie down and watch as this continues. We're in consultations with all other public sector unions. And very soon, if this situation remains unremedied, we shall come out strongly and give our position on the next course of action.
Chibanzi, KTN News.
Let's now take a look at the latest COVID-19 numbers. Kenya has recorded 179 new